Us now, former FDA Commissioner Dr. Scott Gottlieb. Dr. Gottlieb, a lot of questions for you this morning. First of all, where do we stand in terms of coronavirus? Still in the first wave? Where are we headed? The president says that he hopes it will just go away.
Well, look, we have an accelerating epidemic in the South. States like Florida, Texas, Georgia, South Carolina, Arizona, California are showing an acceleration in number of cases. They seem to be experiencing exponential growth. And this is going to continue. It's going to get worse before it gets better. And the states so far haven't taken aggressive enough action that you're going to see a really dramatic reversal. So what it's going to take is a collective action of individuals being more vigilant, wearing masks when they go out, reducing their social activities, limiting their social circles, because absent a real strong policy intervention, which I don't think we're going to get, we're really dependent upon the collective action of individuals to lower their individual risk, and that ultimately can slow the spread. But it will take time for those actions to flow through.
Doctor, you say the states aren't being aggressive enough. What should they be doing?
Well, they're not going to shut down. I mean, that's the bottom line. And it's going to be difficult for them to shut down. We're now experiencing this sort of resurgence on the backs of a more difficult economy. The first time we went into this, the economy was strong. We were able to shut down economic activity. Now it's going to be much more difficult. I think they should be focusing on congregate settings indoors that are entertainment venues and shut those down. I don't think we should be opening bars and theaters, indoor restaurants in a setting like this, when we know those are settings where this can spread very efficiently. I think we need to double down on efforts to protect settings where you have vulnerable people, nursing homes, settings like meatpacking plants, warehouses where people can't socially distance. We need to be focusing resources on that. And finally, we should be trying to draw on a collective action of individuals. Universal masking. We should be implementing universal masking. It's the simplest thing we can do. That's the least intrusive thing we can do into people's lives. And trying to encourage people to limit social interactions and just practice good behaviors. If they do that on a wide scale, that can affect the contours of this epidemic, but it needs to be followed consistently, and it isn't really right now.
Some pediatric experts are pushing for schools to open and for kids to go to school. Is there an argument to be made, and I'm not sure, should they be wearing masks, that kids return to school because that's better for their health? And the way they contract the virus is different from the way perhaps older people do? And is there an economic model for opening schools first and then businesses?
Look, I think we should be trying to open the schools, and I think we should have thought about this 2 months ago when we reopened certain businesses. Our focus should have been on trying to get the schools open and do what we can to reopen the schools. And that, if we had that focus, we might have made some different decisions about opening things like bars early. Look, kids are less susceptible to the virus based on the data that we have, and they don't experience as severe symptoms. And so they're less likely to get into trouble with the virus. But that doesn't mean they're impervious to the virus. We know they can get the virus, and we know they can transmit it. We've seen outbreaks in schools, for example, what happened in Israel when they reopened their schools. So I think the bottom line is in these settings where you have epidemic spread in Texas and Florida and Georgia and California, I think local school boards are going to be very hard-pressed to open the schools. Even if we want to do it, I think parents on those school boards and local officials are going to have a difficult time opening schools against that backdrop, because we know the schools can be settings of outbreaks. People don't want to see outbreaks in school settings. And we know the kids can be a conduit of spread. Even if they're less likely to spread the virus, they're not impervious to it. So the view that the kids just can't get it and they can't spread it, that's not true. They're far less likely to have a bad outcome. They seem less likely to get the virus, and they seem less likely to spread it, but they still can be susceptible.
So, Doctor, you said the numbers are up, exponential growth in some states. We've broken the record for the most infections per day, I think 5 out of the last 8 or 9 days. And yet you're hearing in the media, we're hearing in the media, that the number of deaths are down. I'm curious, is this because it's younger Americans who are getting this disease, or is there just a lag time and we're just not going to know the impact of these new infections for 2 to 3, 4 weeks?
Well, it's both of those things. Right now, the virus is concentrated more in a younger population that is less susceptible. But there is a lag time. So you look at what happened, for example, in Iran, where they had an epidemic, very bad. They brought the numbers down and they went back up. But the second wave was sort of in a younger population, a lot like here. And then in a full 3 or 4 weeks later, they saw the death statistics start to go up. we are also preserving more life, and we shouldn't lose sight of that. The case fatality rate is likely to go down because of the introductions of better approaches to care and some better drugs and treatments. And so the death rate is probably going to go down, but the number of deaths is going to go up tragically because as we have more hospitalizations, death is a lagging indicator. Time to death for someone who does succumb to this from the initial point of hospitalization is about 14 days. And so as these hospitalization numbers go up, we are going to see more people succumb to the virus. And I think the number of deaths per day is probably going to creep back up above 1,000. So we should separate the number of deaths from the death rate. The case fatality rate is probably coming down. We are preserving more life on a proportional basis when you look across, for example, age cohorts or people who are similarly matched in terms of their health. But the total number of deaths is going to go up nonetheless because so many people are just infected right now. And eventually, it'll seep out of a younger population into an older cohort.
Dr. Gottlieb, we heard again yesterday from the White House as the country set a new record, more than 50,000 daily reported cases, that the reason you're seeing these big numbers across so many states is because this country is doing a better job of testing. And we've heard the president's logic that if you stop testing, you wouldn't have as many cases. We can put that to the side for a moment. But is there any truth, again, because we hear it constantly from the White House, that what you're actually seeing is a better job being done on testing and not necessarily more cases in the country? What do you make of that argument?
Well, we are diagnosing more cases. So at the height of the epidemic in New York, we were probably only diagnosing 1 in 20 cases. Now we're probably diagnosing 1 in 10, although it's probably a little less in states like Texas and Florida because they're becoming overwhelmed. But we're still under testing because the positivity rate's going up. And so the fact that the percent of the tests that are positive is going up is an indication this isn't just a phenomenon of more testing. This is a phenomenon of more virus. We have expanding epidemics in these states. So we might be capturing a higher percentage of the cases, but we have more cases. And so we're probably diagnosing 1 in 10 cases right now. So the 50,000 infections that we're diagnosing are probably around 500,000 infections a day that are actually occurring around the country. 20 to 40% of those are asymptomatic. So there maybe are 200 to 300,000 people who have COVID, who have symptoms, who are being new cases on a daily basis. And then we're diagnosing about 50,000 of them.
All right, Dr. Scott Gottlieb, thank you very much for joining us this morning. And still ahead, we're awaiting some important figures that will offer insight into how the U.S. economy is doing amid the coronavirus pandemic. June employment data and the weekly jobless claims report will both be released this morning. We'll have the numbers for you when they cross.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.